I just wanted to ask you about the eventual rollout of a COVID-19 vaccine. At the Defense Committee today, senior military officials who were testifying in front of the committee said that the military is going to play an active role in the distribution of the vaccine. In the United States, we've seen with Operation Warp Speed, the U.S. Army playing a very active role, an essential role in the delivery and procurement of the vaccine, even going as far as to say that there will be armed guards guarding the eventual vaccine vials. So just wondering if you could perhaps elaborate on that. What kind of role will we see the armed forces play here in both the procurement of the vaccine and also in the distribution of the vaccine?
Well, that's an excellent question. Let me say two things. First, a starting point, which is that Canada is among the best positioned countries to access the vaccine. We have an agreement with 7 different companies. We also have the largest number of doses per Canadian, per capita, among all countries. So we have a very strong starting position. And second, obviously, having access to a vaccine is something great, but actually transporting it, storing it, administering it is obviously essential. So that's why we are going to monopolize, to use all the resources that Canadians can muster, and that is certainly including the discussions and actions with armed forces, public safety, Health Canada, PHAC, the procurement people in the government are also working very strongly and actively together.
On COVID-19 more generally, back in March, both the Prime Minister and the Deputy Prime Minister, Chrystia Freeland, said that enacting the Emergency Measures Act was a last resort. At that time, there were only about 2,500 infections nationally. Now we're continuing to break records in Ontario and Manitoba and parts of the West. We're seeing numbers that are far worse than they were in the first wave. Will the government reconsider implementing the Emergencies Act? Is that something that's on the table that you're discussing at Cabinet now? When will we actually hear if that's an option on the table?
Well, as the Prime Minister said, invoking the Emergency Act is a measure of last resort. That obviously has to be considered with many other measures that we're currently using, and more importantly, in consultation and in collaboration with provinces and territories. So the Prime Minister has said those sorts of discussions are ongoing, have been ongoing since the start of the pandemic, and I would turn you back to him to know exactly where they are at this particular moment.
I have to check if we have a question on the phone. If we then we'll come back. Operator, do we have a question on the phone for Minister Duclos?
On the phone.
There are no questions registered at this time.
Perfect.
I was just going to, is that a consideration though? I mean, I know that the advice is evolving. We just saw Dr. Tam go into Cabinet. I know that there are conversations ongoing with the provinces, but is that an option that's on the table, given the fact that we're about to enter into the winter and we could see the cases in the second wave continue to rise and the situation deteriorate altogether?
It certainly is a tool that is available. That tool would be useful only if it was there to support the work of provinces and territories in ways that they wouldn't be able to do or to use without that Emergency Act. So again, it's really to support them, and at this point, as you may have heard, provinces and territories have not been asking for the Emergency Act.
I'm just going to, my colleague ask a question.
Any update on when the fiscal update will be?
On when?
When the fiscal update will be?
Oh, I know. We're looking forward to that. The Minister of Finance will obviously have more to say very soon. Thank you.
Thank you, Minister.
So is there any update on what's happening in Neskantaga? Hopefully I'm pronouncing it correctly.
Neskantaga, that's good.
Yes.
Well, we're engaged with the chief and his team. There have been a number of demands made by the community that I responded to not this Friday, but this past Friday, and we're agreeing to all the requests that are feasible that the chief has asked for. The real concern, obviously, is operating in a COVID environment, working with the teams on the ground. We had the news that one of the contractors had tested positive. Luckily, of the 51 additional tests that were made, thanks to rapid testing, there was no positives uncovered as a result of that, which is some good news. But it's just a testament to working in this environment and a very, very tricky situation of ensuring this community that's gone a quarter century without clean water actually gets it. So the update I have is that the new plant is up and running. There needs to be a couple-day period where before the 14-day cycle occurs, where the systems are flushed, and then they do testing for about 14 days to make sure that indeed that water is clean. So far, so good. We're somewhat cautiously optimistic, obviously taking nothing for granted. And then the discussion with Chief and Council about the repatriation of the community members who obviously want to be at home at this time of year. Again, the situation with COVID is worrisome, especially with the reports of a few cases in Thunder Bay. Being in a hotel in that environment is not ideal, so we've been mobilizing throughout mental health supports, ensuring the kids get the schooling that they're entitled to, but always, working with the chief and council and getting their community back to Neskantaga safely.
So, when can they get back? When do you think so?
This is a decision that's ongoing. The date that we have right now, it could be before, could be as early as December 2nd, 3rd, or 4th, and perhaps earlier. It's sort of it's a fluid timeline, but it's a timeline that we will respect according to the community demands.
Okay. Check on the phone, see if we have one question for Minister Miller.
The first question is from Madeleine Blais-Morin from Radio-Canada. Please go ahead, à vous la parole.
Bonjour, Monsieur le ministre. Je ne sais pas si vous avez vu notre enquête de Radio-Canada sur des allégations de climat de travail malsain au sein de la Direction générale de la santé des Premières Nations et Inuit pour le Bureau de l'Atlantique. Et si oui, quelle était votre réaction face à ça?
Oui, Madeleine, je l'ai vu et j'en ai parlé avec ma sous-ministre. Sachez que la responsabilité pour ce genre d'allégations et faire le suivi, évidemment, sachant que nous avons une politique de zéro tolérance si des allégations s'avèrent vraies, tombe sous la responsabilité de mon sous-ministre et je lui ai parlé durant la fin de semaine pour assurer qu'il y a un suivi qui sera fait à l'interne pour savoir et savoir les réponses exactes.
Qu'est-ce que vous entendez par suivi à l'interne, s'il vous plaît?
Quand il y a des faits qui sont allégués, il y a un processus de déontologie qui est mis en place. Il y a certaines garanties, évidemment, de confidentialité parce qu'on parle d'employés qui ont droit à ce processus de confidentialité, à la fois pour protéger les gens qui font ces allégations et leur statut de travail, ainsi que ce droit qui est un droit fondamental, ainsi que la personne envers laquelle ces allégations sont visées.
Est-ce que c'est possible de répéter en anglais ce que vous venez de dire, faire un résumé de la première et la deuxième réponse?
Madeleine, j'ai mal entendu la question.
Est-ce que vous pourriez répéter en anglais pour nos collègues de CBC, s'il vous plaît?
Okay, yeah, sure. Thanks, Madeleine. This is obviously the alleged facts. Now I'm translating from French. the alleged facts are ones that we take exceedingly seriously. The department has a policy of zero tolerance if those allegations turn out to be true. The professional review that needs to be done and follow up internally is a responsibility that follows under the responsibility of my Deputy Minister, Christiane Fox, and I spoke with her during the course of the weekend to assure that was being done. Again, because of labor laws, there are confidentiality requirements, both to protect the victim and the person against whom the facts are alleged. So I will leave it at that, but Canadians should know, following that report, that we are taking these things exceedingly seriously internally.
Noah?
Hey, hi, Minister. Nice to see you. Sorry if you can hear me through my mask.
Yeah, that's good.
It's Noah Richardson from CTV National News. I was following the Defense Committee today, and senior military members were testifying about military efforts to help with the procurement and distribution of a vaccine once one is approved for use in Canada. Obviously, there are lots of complications with distribution, but I'm wondering from your portfolio whether you will be asking the military to involve itself in helping distribute the vaccine to remote and northern communities that might not have access to vaccine otherwise. Will you be having members perhaps fly into the communities to help members get access to the vaccine?
Well, we're talking about an exceedingly complex set of factors that could involve the military. I think Canadians should know that all options are on the table. As we've seen, we have a number of options with respect to vaccines, despite news reports about the preliminary success. We are looking at them very cautiously. It is perhaps one of the most challenging logistical deployments of a vaccine across the world. And when it comes to Canada, there are a number of scenarios that are being painted currently, and we shouldn't exclude, obviously, the military and their incredible work that they do in getting to remote places. We, at ISK, from the very beginning, when it comes to the 100+ remote locations that we fly into, have been ensuring that there has been an exceedingly high standard of sanitary protocol, going to the lengths of chartering planes to ensure that nurses are getting into communities and out without they themselves becoming vectors. This will be a very much of a similar operation, and with all options being on the table, clearly we know what the military brings to the table when it comes to the distribution of vaccines in an effective fashion to communities that not only have felt underserved and sometimes betrayed by the medical health system, but also because of location find it exceedingly challenged to get timely health care. And so it's very hard to generalize because each community is different and each community has different levels of capacity. But this is stuff that I'm working on internally and with Cabinet to ensure that Indigenous peoples aren't left behind. And in fact, they're prioritized because of their vulnerabilities. I mean, we see the numbers from the second wave, and I'm sorry to dominate your question, but we're looking at double the active cases right now in Indigenous communities across Canada than the entire number of cases during the first wave with respect to Indigenous people. This is very important. There was a lot of work that was done by leadership during the first wave to prevent Indigenous communities from getting infected. It took hard work, communication, lots of logistics. During the second wave, we're seeing them hit a lot harder. If we look at our cousins to the south, Indigenous communities, depending on which community you look at, 3, 4 to 5 times harder hit, and 5 times when you look at Alaska. So there is some stuff that's been done right, but we shouldn't be taking that for granted. We just know that there is some stuff that works. And when it comes to that level of vulnerability, that vulnerability hasn't changed. There perhaps some good work that's being done to know a little bit about COVID and to how to use public health protocols and sanitation protocols, closing down communities. But we're not out of the woods by any stretch of the imagination. And those communities, therefore, remain exceedingly vulnerable, and there should be priority given to them.
If you wouldn't mind me asking just a quick follow-up. I want to ask you the same question I asked your colleague, Minister Duclos, a few minutes ago. Given what you just said, and given what other ministers have said about not being out of the woods, that's something the Prime Minister continues to repeat. Even Minister Hajdu said today, despite the good news on vaccines, there are still dark days ahead. I want to ask you about the Emergency Measures Act. The Prime Minister and the Deputy Prime Minister, back in March, when we only had about 2,500 cases nationally, were saying that the Emergency Measures Act.
There was a charter after the War Measures Act, and it was actually redone as a result. So it's a much different act. I know it's on top of your mind.
The Emergency Measures Act was something that would be considered as a last resort. Given where we are in the second wave, the fact that we're heading into the colder months, and given all that you've said about what's happening in some of our most vulnerable communities, is that something that's on the table right now within Cabinet, something that's being discussed, and that the government might consider should the situation continue to deteriorate?
Well, knowing that I'm not going to discuss with you publicly what goes on in Cabinet, what I can say is what I've heard from Indigenous communities in the first round of consultations that we did because we have to as part of the Act, is talk to Indigenous communities, is there was a wide-scale rejection of the Emergencies Act, particularly because of the level of consultation that communities felt they required before agreeing to this. While there may be benefits to it, what we are talking about, and it isn't a theoretical exercise, it's a very practical exercise of looking at the healthcare system and which healthcare systems may need more help, which ones don't. And without the cooperation of provinces, which is a very real possibility should something be invoked unilaterally, there's a challenge to the effective implementation of what we're trying to achieve. So I suppose I could stand here from Ottawa and say it would be a great world if we could decide everything. But knowing what I know working with Indigenous communities, that's yielded some horrible results in the past, and it may very well yield the same should we do so unilaterally. What we've known is that working in partnership, and I'm facing this in Manitoba, needing to work with the provincial government, knowing that mistakes have been made with respect to the second wave, knowing that there has to be partnership there to have effective testing, isolation, tracing, tracking, reaching out to hospitals saying, hey, where do you need help? Looking at provincial hubs where Indigenous communities would move towards should there be more needs for medical supports, and saying how do we best help, and Opaskwayak Cree Nation is an example of that. We need the regional health authorities to be stepping up, and we're there to help. Creating a political storm in the middle of this, I'm not going to speculate, but it actually could cause delays if we were to do it the wrong way. So at the risk of not having a clear yes-no answer to your question, I just thought it is important for you to know the range of challenges we face for a very, very practical question of how to keep Canadians safe and alive. Thanks.
Hello, Minister. My name is Mohamed.
How are you?
Press. Good. How are you?
Yep.
So today the Canadian Heritage Committee was examining the Bill C-5 that is to turn the Orange Shirt Day to a national holiday, and some witnesses, actually those who were actually survivors of the residential school system, called on Ottawa and other provinces to create and to build monuments across the country to honor those survivors of residential schools. Do you think Ottawa, or in general the country, has done enough to honor those survivors, and if not, why?
I don't think we've done enough. I think we've done a lot. When you look at creating heritage sites for some of the residential schools, for example, there's a lot of painful memories associated with them. There is a great movement to preserve some of those things, and there are some communities that would say we want to get rid of them, we don't want to see them anymore, we don't want the visual associated with it. And I can understand that. So it goes back, by extension, a bit to the question I just answered your colleague. We have to be working with those communities to see how best to highlight a very painful heritage. And how that's done is as important as to whether it's done in the first place. And so I make it a point not to substitute my voice for those Indigenous groups that have views on it, and I respect them. It's not an excuse not to move when we're told to move. I think a big challenge with my portfolio is educating non-Indigenous Canadians as to what Indigenous peoples in Canada have faced, and it's a long haul. It's not done in electoral 4-year cycles, but to know that, and this is why I say it has to be a nonpartisan issue to highlight these things, because no matter what government succeeds us, they need to continue on a very, very difficult path that they know they will make mistakes on, but being aware of that and knowing that those mistakes will be made with a view to reconciling goes through one thing, which is telling the truth, which can be excessively painful for those groups. So I suppose I could declare all sorts of days and of reconciliation and thought, but without the work and partnership of Indigenous groups, it would perhaps be for naught. Thank you.
Hi, Minister. I just wanted to ask you, today we reached another grim milestone in this country as we hit 300,000 coronavirus cases. Just a month ago, we had reached 200,000 cases, so I think that's indicative of how quickly the virus spreads, as you know. But knowing this milestone and knowing the fact that provinces and territories are grappling with how best to respond to the crisis, we just heard from Nunavut today. They're going into a lockdown as they hit their first positive case a few days ago. The province of Manitoba, numbers are out of control there. I just want to ask you, you just came from Cabinet, when will the government reevaluate whether it's now time to invoke the Emergency Measures Act, given the fact that provinces and territories have differing approaches to handling the virus?
Well, first of all, look, I'm deeply concerned about the growth, and we are in exponential growth, which means that now, as I talked about before, we're talking about the days to doubling, and that's a scary place for any country to be. I've been working all weekend long with my colleagues and my counterparts, ministers of health, and in fact local public health officers across the country. We'll continue to do that to make sure they understand what we can do to support them, but also the limits of that support, because ultimately provincial health care is within their jurisdiction and they have to make those tough decisions. It is good to see provincial governments take decisions early and quickly, like Nunavut is doing, to prevent the spread, especially in areas where there is fragile healthcare system, such as in northern communities like that territory. We do know that if you act more quickly with the virus, that you actually have a better chance of putting out the spread more quickly, and obviously we work with provinces and territories to do that. Again, this is really our role at the federal level is to help support them to take those strong actions, whether they're economic supports for business, as the Minister Freeland is pursuing now with Bill C9. These are good things that are going to help businesses on the ground when provinces and territories have to take those stronger measures. And we need a Team Canada approach. Everybody has to be pulling together. So I'll just repeat to Canadians that it will require all of us. The next several months are going to be difficult for all of us. This is a hard time. It's a hard time around the world, especially in countries that are in northern climates that are seeing a growth in cases as people move inside. So we're going to have to reduce our gatherings, making those hard decisions to not have a small intimate dinner party, to not actually have friends over for a drink, to reduce our goings about our daily lives and really go back to basics. What do we absolutely need to do? How do we keep ourselves healthy? How do we keep our family and our community healthy?
Thank you. And look, we all understand how federalism works, and I understand that it's tricky when there are jurisdictional issues and jurisdictional concerns. But there are top doctors in this country who are calling for a whole of Canada approach, a so-called circuit breaker, doing temporary, more restrictive lockdown measures in order to stop the spread, at least temporarily. So when you have senior public health officials from various provinces saying more needs to be done, when you have mayors saying more needs to be done, why not take a whole of Canada approach? You keep saying we need to take a Team Canada approach to this, but at the same time, shouldn't it be up to the federal government to lead the response and set the example here?
The federal government has been there and will continue to be there for provinces and territories as they work to have the tools in place to take the measures that are going to be appropriate for their region. And listen, again, the Prime Minister was very clear a few days ago in terms of our ability to directly deliver health care and provide additional supports. Those are limited, and the provinces and territories know that. So they must act quickly to contain the spread. But having said that, we will be there for Canadians, and we will continue our work to make sure that provinces and territories can access personal protective equipment and that they can access vaccines, and that we have a good distribution plan with provinces and territories to get that vaccine out. And at the end of the day, provide the economic supports for Canadian families and Canadian individuals who are struggling financially as a result of any regional lockdown. And we'll continue to do that work because we're going to, as many of us have said, be there and do whatever it takes to get us through this.
If we have any questions, operator?
There are no questions registered at this time.
Okay.
Thank you, Minister. Appreciate it.
So, Minister Champagne, do you believe that the treatment of Uyghurs amounts to a genocide?
Can you? Sorry, I could not.
Yes, that's okay. Do you believe that the treatment of Uyghurs in China amounts to a genocide?
Well, I say we have expressed on many occasions that we are gravely concerned about the situation in Xinjiang. I raised this issue both privately and publicly with the Foreign Minister of China, and I will continue to do so. And I would even add that very recently, Canada spoke with other 38 countries in the world to call for experts to be able to go in Xinjiang to assess the situation and to report back. And this is in line with the discussion I had with the UN High Representative for Human Rights, Madame Bachelet. When I met her in Geneva, we did talk about this issue. So I would say Canada, the position that Canada has been taking with respect to Xinjiang and the plight of the Uyghurs is very consistent We have said it. We have raised the issue both publicly and privately. And we spoke along with 38 nations very recently to ask for independent experts to be able to assess the situation on the ground.
But it's very different to say that you're concerned and very different to call it a genocide. But let me get your response to this. China is saying that Canada should just stay out of its business, and it's very hypocritical for the country to... It's very hypocritical for Canada to criticize China, given our own history with genocide.
Listen, my answer to that would say human rights is a core component of our foreign policy. We will stand up, we will speak up whenever we feel it is appropriate. We have done that with respect to Xinjiang. We have done that when it's respect to Hong Kong more recently, and we will continue to do so. We have done it in Belarus. We have done it when it comes to the plight of the Rohingya. I think Canadians expect Canada to speak up and stand up for people, for liberty, for freedom, for democracy, and for the respect of human rights. Today, Canada was co-hosting the Media Freedom Coalition. And this is another thing where we were pushing, is for media freedom, protection of journalists at the time of COVID. So yes, Canada will continue to stand up and speak up for the protection of human rights around the world.
Hi, Minister. Thank you so much for stopping. CSIS officials have admitted to our colleagues at the Globe and Mail that the People's Republic of China has sent covert agents to Canada to spy on and intimidate members of the Chinese community here in Canada. This is on top of the ambassador here, Mr. Pei Wu, who has made veiled threats, who has made disparaging remarks about our government, about the Prime Minister's involvement in the Meng Wanzhou case. I'm just wondering, at what point does this become such an issue that it's time to expel the ambassador, to revoke his credentials?
Well, I was very clear when the ambassador made these comments. I said it was totally unacceptable, that we would not tolerate that in Canada. And in fact, I did call him for having a meeting with the officials to say that in no uncertain terms. When it comes to foreign interference, we will take all the appropriate measures to respond to that, to protect Canadians, to make sure that actions by state and non-state actors in Canada, that won't be tolerated, and we will be taking measures. And I know that Minister Blair, the Minister of Public Safety, is looking at this question very seriously because we have heard allegations, we have heard from people, and every time I've said to Canadians, if ever you would feel intimidated, threatened, you should contact your local police authority and report these cases so that they can be properly investigated and properly followed up.
But it's one thing for an envoy from another country to make comments about the host country, about the host country's government. It's another thing altogether to send covert agents to that host country to spy on and intimidate the citizens of that country. So I'm just wondering, you continue to say you're going to take measures, but can you be more specific here? What measures are you looking to take?
To your question, I think Canadians can have full trust and confidence in all our federal agencies. We are very much seized of that. We have some of the best agencies in the world to make sure that we can face the threat that has been that you alluded to, and I think Canadians can have full confidence, whether it's the RCMP, whether it's CSIS and other agencies, which are working together to protect Canadians, to make sure that there's no foreign interference in Canada. And every time there's been allegations of foreign interference, I can assure you we take that extremely seriously. We're working now with CSIS, with the RCMP, with Minister Blair to come up with a framework to make sure that we can continue to protect Canadians in light of this new threat. Merci tout le monde. Bonne soirée.
Thank you.
Merci.